Hi, I'm Dr. Nathan Way, and in this video we're going to illustrate 3 hip exercises and 3 knee exercises. Osteoarthritis often affects weight-bearing areas such as the hip and knee, and one of the treatment modalities that people often forget about is exercise, and it's a critical part of the whole treatment program. So hopefully you'll get a lot out of this video, and if you have any questions, please feel free to contact us. Today I'm going to be just demonstrating, actually a model will be demonstrating 3 key exercises for people who have knee or hip arthritis. So 3 exercises for the knee and 3 for the hip. These exercises are designed to maintain joint mobility and joint strength. It's important to realize that stretching and strengthening exercises are critical to maintaining the health of your joints, particularly as you get older and develop problems with cartilage. If you're thinking about having a stem cell procedure, these exercises are highly recommended prior to having the procedure done. So let's begin with the knee. The first exercise is the quad set or quadriceps strengthening exercise. This is the bread and butter of knee exercises. The quads are the strongest muscle group in the body. The stronger your quads, the better your knees will do. You sit in a regular straight back chair, extend your leg, point your toes towards your head, and hold it for 10 seconds. That's 1 repetition. So I would advise starting out with 25 repetitions a day and increase it to 100 slowly. Obviously, if you have arthritis in both legs, it's a good idea to do the exercise for both legs. You can do this at lunchtime, at dinner time. You can break up the exercises just so long as the total number of repetitions equals what I just talked with you about. Starting with 25, moving up to 50, and trying to get up to 100 when you can. The second exercise are the hamstring strengthening exercises. The hamstrings counterbalance the quads, so they need to be strong too. Now, we have a piece of shelving here in front of the front legs of the chair, but you can also use a cane or a 2x4, and you put it in front of the front legs of a chair. You put your heels against the cane or the 2x4 or a piece of shelving and push back with your heels as hard as you can for 10 seconds. That's an isometric 10-second count. That's 1 repetition. You should do at least 10 repetitions a day. The third exercise is the ball wall exercise. You need to stand with your back to the wall with a ball in the small of your back and slowly lower your body by bending your knees. Then you stand back up. You do about 5 to 10 repetitions to start. Don't go too low, since this can really put a lot of stress on the knees. And if you have what's called patellofemoral arthritis, in other words, a lot of arthritis between the kneecap and the upper leg bone, you might want to skip this exercise because this really does stress the patellofemoral joint. But if you have medial or lateral compartment disease, this is pretty good. This exercise also strengthens the quads. You should start out with about 5 reps and increase slowly as your exercise tolerance builds. Now let's focus on the hips. Now, for this set of exercises, you really ought to use a mat. And for people that have neck problems, you'll probably want to have a pillow handy too, and you'll see why in a bit. The first exercise is an internal rotation stretch. Internal rotation is the first motion to be lost in patients with osteoarthritis of the hip, and is the one that's most important to gain back. So the way you do this is you bend your knee for the leg that you want to stretch, and then you internally rotate the hip, keeping your pelvis flat against the floor and sort of giving a gentle, slow push against your hip so that you're internally rotating that hip. Notice how it's probably a good idea if you have any neck problems to have a pillow under your head, and after you've done one side, again you rotate the others, you go to the other side, and I think you can see it better from this angle. You see how the model is now internally rotating her hip and holding it there and trying to stretch it as much as she can. And I would hold it for at least 30 seconds. Sometimes you may have to start out with 10 seconds at the beginning, but then move up to 30. The second exercise is thread the needle. This works on external rotation of the hip. Again, you lie on the mat, you put one leg across the thigh of the other, just crossing your legs, and put your hand through the hole and clasp your hands behind the thigh and gently pull up. And you can see that this is a great exercise for external rotation. Again, I highly advise that you use a pillow under your head if you have neck problems. And then you switch to the other side. And again, you cross your leg across the other one. You clasp your hands behind the thigh and pull up. Again, a 30-second stretch is a good idea for this one. Final hip stretch is this. You place one leg underneath your chest in an internal rotation position, and you extend the other leg backward, and using the weight of your abdomen and chest, you sort of lean forward so your body weight is pushing your hip into internal rotation. Be careful not to jerk or push too hard. Then you switch to the other side. And you can see that this is a wonderful exercise for internal rotation, and what it does is it allows you to take advantage of using your body weight to get your hip into internal rotation.